Morning. I
Good
am Miss
morning.
Padmaja. I am Miss Padmaja, a nurse. You had come to visit to a clinic for your injection. May I know your name, please?
A very good morning, Nurse Patmacha. My name is Sarah. Yes, you are right that I have visited the clinic just to have my first injection of vitamin B12. But I have a lot of concern with regard to my condition that I was told that I'm suffering from this pernicious anemia, and I don't know what is the cause and reason, and how long do I need to go for this vitamin B12 injection, and could you please explain the things in a better way for me to understand?
Sure, Sarah. I will help you to clear your doubts. But let me know whether there is any family history of having this vitamin B12 deficiency.
I'm not very clear about vitamin B12 deficiency, but I had observed my mother also. She was also suffering from anemia, but I don't know whether it is a pernicious anemia, but she was suffering from anemia. So do you come
Well,
to say that it is a heredity? Heredity, is it playing an important role in this?
yes, yes, hereditary can play an important role because it is being transmitted through the genes. And
Okay.
usually, yes, usually the patients they come with this vitamin B12 deficiency, but may not be always. There may be some other genetic disorders, especially the people those who are having an autoimmune diseases. They may land up with vitamin B12 deficiency. So, can I know what is bothering you?
Well, nurse, I could say you some signs and symptoms that I've observed almost for the past 3, 4 months. I think I have delayed to visit the doctor, but I started to experience. I'm 30 years old. I started to experience a kind of fatigue and a shortness of breath and some kind of fluctuations in my heartbeat, right? And sometimes I get numbness in my hands and feet, a kind of tingling sensation, and also sometimes I had a loss of appetite, diarrhea. So these kind of symptoms started to persist day by day. It started to increase one after another. So that's my fear. That's the reason I visited the doctor, and I was confirmed that through the blood test that I suffer from this pernicious anemia.
Yes, well, Sarah, I know that you are very much concerned because of the symptoms what you are experiencing, but I would like to know regarding your dietary habits. Can you tell me?
Well, no, sir. As far as diet is concerned, because I told I'm 30 years, I have not, had an idea that I would get some kind of heredity anemia like this. So I just generally eat a normal food, and being a vegetarian, I eat all kind of fruits and vegetables. Vegetarian diet, yes, I eat even egg, but I'm not into any kind of non-vegetarian food.
Okay. Well, I would like to clarify your doubts. One, that what you have said that you were experiencing fatigue and weakness during the activities and all. Well, it is associated with vitamin 12 deficiency because vitamin 12 deficiency will lower your hemoglobin. It won't help you to build up your hemoglobin. If I think you may be aware of this hemoglobin level and what is the role of that. Do you know?
Honestly speaking, nurse, I have very poor idea, but I do know that a person who is anemic, it is a decrease in the blood level, the RBC. That is the only idea I know.
No, if a person who is having anemia, that means it is not the decrease in the RBC or the blood cells, but it is a hemoglobin level. The hemoglobin level is being set with the help of the red color which gives to the blood cells. So, well, in this vitamin B12 deficiency, you will find that because of the typical protein which is transmitted with the help of the gene to the cells, that is deficit, and hence it doesn't allow whatever you eat the iron, so that iron will help to build up the hemoglobin level. So if I if I go into a depth to explain you, you can understand very well. That is the hemoglobin is heme is and a protein part. So when these two parts join, here in vitamin 12 deficiency, you will find that the protein part will get lacked, and hence the iron, whatever you take it from your diet, will not reach to for the formation of these hemoglobin. And hence you will find that these patients, those who are having a genetic problem with the transmission of vitamin B12 through the protein binding transport system, will have this deficiency. But I think you will be all right with the help of medications, as well as if you focus on your diet. It will help you to recover from vitamin B12 deficiency, and sure that you will be feeling all right after receiving injections and improving your dietary habits. And let me know if anything.
Hello.
Hello.
Yeah, disturbance is there in your voice. Yeah. What do you say? Let me know.
Let me know.
Hello.
Uh,
Disturbance. Disturbance is there, Padmaja.
Because no one is there at home today. Hello?
Yeah.
Yes, ma'am.
All right.
Can you hear me?
Yeah, now I could hear. What would you say that? Let me know.
Let me know the things which bothers you.
All right. See, actually, what you have explained to me, you started to say that no decrease in no, red blood cells is not the reason. Actually, it is one of the reasons. Okay. See, actually, prenicious no, anemia, which means that it is a decrease in the red blood cells. Because the body cannot absorb the vitamin B12 enough. It cannot absorb because of the decrease. And also, you have told autoimmune disease. It is an autoimmune condition. See, actually, lack of vitamin B12, that is the main cause and the signs and symptoms of this, of pernicious anemia. Yeah, anemia. And without vitamin B12, it is not possible for the body to absorb the red blood cells. Okay, so that is the main idea you have to. Rather, you have given a lot of information which is not easy for a lay person to understand. So give that information as crisp as possible. And autoimmune condition you told. So autoimmune condition means patient might not know. So when you use some term, you could say that what is autoimmune condition? It means the immune system, that is the body's natural, defense system that is protecting us from the illness and infection. It is getting affected. So what happens means the healthy cells are getting affected. So when the healthy cells get affected, automatically you will have this kind of deficiency, this kind of problem, and that is mainly because of vitamin B12 deficiency. So you could say that you have to incorporate a lot of vitamin B12 in your diet. As you told, it is quite unfortunate that you are a vegetarian, because a lot of vitamin B12, what is the food which is giving you vitamin B12 means in general non-vegetarian food like meat, beef, liver and poultry and fish. But it is quite unfortunate, as you told, you are a vegetarian. Being a vegetarian, you can get vitamin B12 only from the dairy products like milk, yogurt and cheese. But good thing that you are eating egg, you told. But you have to go for the supplements. And that's the reason the doctor would have recommended you to go for this vitamin B12 injection. So make it very crisp and precise. Rather, too much of medical information is not needed. So first of all, you have to say what is autoimmune condition. And the red blood corpuscles decreasing, RBC is decreasing from the body because the vitamin B12 is not absorbing it. That is the main reason. You started to say that no, it is not because of the decrease in RBC. It is the cause. Okay, so that you have to be little careful. And when you say what food to be eaten, what not to be eaten, also simultaneously you could have told, like caffeine, right? Any of the anything. If you are having a drinking or smoker, with that bad habits, you have to quit, that you could say. And even sometimes any food that has got more oxalic acid, like peanuts, so some people would be eating a lot of peanuts, peanut butter, chocolate, they might get into the habit of eating. So you have to say they have to avoid tea, coffee, no, the beverages. And yeah, so that is very, very important. And especially these products, peanuts, they have to avoid if they are anemic. So you have to, what to eat, what not to eat, at least 3, 4 food to be eaten, 3, 4 foods to be not eaten, that you could be clear. Okay.
Okay. Yes,
Right.
ma'am.
So rather explaining so much, because as I already told last class also, no, lengthy dialogue you are speaking and too much of complicated ideas. Make it as simple as